Hello and welcome everyone. Thank you for joining us from across time zones. As you all know, Fireside Chats is a space to celebrate, showcase, and learn from the power of collective action for menstrual health and hygiene. We believe that through collaborative advocacy and pursuit of evidence-based solutions, we can catalyze a movement that propels MHH to the forefront of priorities. Fireside Chats is a collaborative initiative by the Global Menstrual Collective and the Menstrual Health Hub. It is currently co-facilitated by Arundati Muralidharan from GMC and myself, Bhuvana Balaji from MH Hub. To keep up with our ongoing efforts to experiment with new formats, we are excited to introduce Weathering the Cycle to you, which is an ongoing series focused on exploring the connection between menstrual health and climate change. Through this, we aim to advocate for the integration of menstrual health and hygiene efforts into mainstream as well as allied climate initiatives out there. Today's Fireside Chat is the first of this four-part series focused on both the big picture of what this intersection means and digging deeper into efforts by organizations and networks that are actively working in the field of climate resilience, mitigation and adaptation in the intersections of menstrual health and hygiene, gender, and sexual and reproductive health rights. And we are super excited to see the kind of response we've received over the past week or so since we made the announcement. And we look forward to making the next 75 minutes as valuable as it can get. Ritika, maybe we can move on to the next slide. We can quickly do some housekeeping norms. Let's please mute our microphones. Please keep your videos off. Please do introduce yourself on chat. And we would like to hear your questions for speakers on chat as well. Also, if you're not able to be part of the whole conversation or if you've joined midway, it shouldn't be an issue because we will be sharing the recording and also some key takeaways for you to reflect upon and also share it with your colleagues and see what are the next steps you can build on for yourself, your organization, your network, and your institution and the communities that you work with. Thank you so much. I will now hand this over to Arundati for a quick summary of all the effort that's gone into the work that Global Menstrual Collective has done as part of the action working group around climate action and menstrual health. Arundati.
Hey, great. Thanks so much, Bhuvana, and great to see everyone here. I'm going to share my screen and let me know if you can't see it, Bhuvana.
We can see it. Yeah.
Super. So as Bhuvana said, this is an emerging area of work and interest. We do know and we acknowledge that there has been work around menstrual health in the context of emergencies and disasters and humanitarian contexts. And there is a significant overlap with climate change. And we do also have a fairly rich body of work that's happened on climate change, its intersections with SRHR. We even have a speaker who's going to be talking to us more about that. Climate change and the gender effects of climate change. But what we began to realize is when we're looking at menstrual health in the context of climate change, there was sparse literature, and we wanted to dig into that more and kind of inform how we're shaping the narrative and broaden that narrative to examine various aspects of this. So with that, the Global Menstrual Collective has started a working group this year that was specifically looking into this issue. And we're going to be quickly sharing some of our insights, which is very much a work in progress. So we welcome your thoughts and insights as we move in. So very quickly, just a reflection of what climate change is. So climate change, as many of you already know, are long-term shifts that are happening in terms of climate, which is both shift in temperatures as well as in weather patterns. And why this is of concern is because we're seeing that climate change, especially in our lifetime, is increasingly affecting people, our lives, our livelihoods, our health, the ecosystems that we are a part of. And we see that this is happening both through extreme weather events, acute weather events, as well as persistent, slow-acting, and long-term effects of climate change events. And this is affecting us in various ways. What's also concerning is that climate change builds on vulnerabilities and enhances vulnerabilities of communities and individuals who are exposed. Now, what we have also seen, and which many of you have seen play out in your own work, is that climate change is a gendered issue. It affects everyone, and gender plays a role. And this means that both men and women are affected, and some of those effects are different. They are not lesser or greater, but they are different. And increasing research and field insights are showing that. We see increasing number of climate-related disasters, a great number of people, especially in low and middle-income countries, who are living in contexts and regions that are climate vulnerable. We are hearing more and more stories as to how girls and women are disproportionately and uniquely affected by climate change events. And worryingly, we see a recent report that said that 158 million more girls and women will be pushed into poverty in the next 25 years as a result of climate change. So quite some stark statistics. There was a great report and a systematic review that pulled together research of about 130 studies, and that looked at the gender dimensions of climate change. And again, here you see that men and women are affected by climate change, but then those effects tend to play out differently, as we're seeing in a lot of this research. So you're seeing here that for many issues, women and girls are more affected, and for some issues, men may be more affected. But when we're looking at reproductive and sexual health issues, then of course women bear the brunt of the adverse impacts of climate change on that. Now, across all this literature, menstrual health is something that did not emerge strongly. But at the same time, for many of us working in the space and in climate vulnerable areas, we're seeing that this issue of how do we deal with menstrual health and hygiene does emerge. So today we want to be looking at unpacking some of those. Now, the dominant narrative, if we're looking at menstrual health and hygiene in the context of climate change, tends to center around menstrual products. Now, menstrual products, both single-use and reusable products, have their environmental and climate implications. We won't dig in too much into that. But what we do want to share is that the implications of these products exist across the value chain of those products, right from the time that those products are produced or manufactured till their end-of-life treatment. So if we're producing a particular kind of product, what are the raw materials that are going into it? What is the energy that we're consuming to make those products? What is the energy that we're using to ship those products from one location to another? And then, of course, the aspects of usage, disposal, and then final end-of-life treatment. Single-use products, both tampons and single-use pads, do add to waste volumes, and there's some concern around that. So those waste volumes, compared to others, are quite less. Waste management solutions for discarded products are often inefficient, and they do contribute to some extent to environmental degradation. But the linkages with climate change must and do go beyond single-use menstrual products per se. And that's the narrative that we want to broaden for you today through this presentation and our speakers. What we're seeing and what we're hearing is that climate change-related acute and extreme weather events affect people in various ways. They constrain access to essential menstrual products of choice due to disrupted supply chains. They cause disruption or acute shortages in essential services like water, sanitation, hygiene services. They compromise, as a result of this, hygienic use of products and personal hygiene behaviors, and even disposal of products. It restricts worryingly access to health services and support services, access to information, and schools for girls, where they often get a lot of their support, information, and products. Sorry, let me just move my slide along. Climate change related slow onset and long acting events. For example, if you're extreme heat waves, drought, etc., rise in sea levels, these also are concerning though the effects may be slower for us to see as compared to the acute events, these slow-acting and long-acting events lead to the loss of health and support services. They often result in a loss of livelihoods or affect household income in various ways. And as a result of this, it often leads to a deprioritization of the needs and very personal health needs of girls and women. It does, in the long run, constrain access to products, services, and facilities. We're hearing that it intensifies pervasive and inequitable gender norms, and it increases vulnerabilities, especially when this is combined with issues related to forced migration, as well as conflict, which we do see in several parts of the world today. Climate-related events, whether they are acute or long-acting, affect the safety and privacy of girls and women, and we're also hearing and seeing that they exacerbate stigma and discrimination, and these are particularly concerning for us, given the state of gender equality in the world and the investments that are being done in that space. Now, challenges that may be particularly acute and groups that we need to perhaps bring into focus more are girls, young girls who are attaining puberty, attaining menarche, girls and women with menstrual problems and disorders, women in the perimenopausal and menopausal space, persons with disabilities, persons with gender diverse identities, and individuals and communities who are already marginalized or vulnerable due to various other socioeconomic factors. There is another issue that we've been hearing some conversation about, and we've been digging into the literature, is how air pollution affects menstrual health. Now, air pollution is not a result of climate change. It's contributing to climate change. As we know, it's contributing to those greenhouse gas emissions. And the literature that we're seeing worryingly points to that high exposure to air pollution is often associated with endocrine disruption, which means that it could lead to hormonal imbalances. The limited literature, the clinical literature that exists, is indicating that these kinds of endocrine disruption and hormonal imbalances can be worryingly associated with early age at menarche. So we're seeing girls start their periods at as young as age 8 and 9 years. It could also be associated with early menopause that has significant health concerns for women's health in midlife and beyond. And it's also associated with certain menstrual disorders and concerns like endometriosis, PCOS. Now, this is all very, very new. And so we need a lot more research to understand these pathways, but we're just putting this out there for your consideration that this is also an aspect. So as you can see, the interlinkages between climate change and menstrual health and hygiene are quite complex. They're multifaceted. We're digging into this. There's a lot more that we can be looking into. Some of these interlinkages are more direct, as we can see with acute climate-related events, and some of these may be more, they may be more hidden, more indirect, but nonetheless quite powerful in the long run, having adverse effects. Our GMC Climate Change Working Group came up with this infographic a few months ago that we tried to outline some of these interlinkages and are further working to refine this. We'll share the link on this in the chat box. And if you have any thoughts and feedback for us, we'd love to hear your thoughts. So with that, I'm going to end this kind of context setting and welcome your thoughts on this more, and handing over to Bhuvana to take us to our exciting speakers.
Thanks, Arundati. Ritika, can we please pull up the slide? Thank you. So as you can see, we do have an exciting panel here today with us. We have Viva Tatawaqa from Viva for Equality, who is a grassroots feminist organizer from Fiji with extensive experience in the Pacific region. We have Lady Lisondra, who is the youth and advocacy advisor at International Planned Parenthood Federation, and specifically working in the East and Southeast Asia and the Oceania region. We have Ali Beeman from YLabs, who's based in Kigali with extensive experience in researching sexual and reproductive health rights among adolescents worldwide. And we have Stella James, who specializes in environmental and climate law and justice research, advocacy, and practice. A very warm welcome and thanks to each one of you for agreeing to bring your insights and experiences to this discussion. Can all the speakers keep their videos on, please? I think that would be really nice. Thank you. Thank you so much. Thanks a lot. Okay. I would like to start by asking each one of you, what are some significant ways that climate change affects the population you work with? Viva, we would like to maybe begin with you and understand what are some of the challenges of working in climate sensitive Fiji and advocating for gender and climate justice in the region.
Thank you, Bhuvana. Warm greetings and Bulavnaka from maybe like good evening from Fiji. It's after 9 p.m. evening. So let me get straight into it. A lot of with Viva for Equality Fiji and Diverse Voices in Action for Equality, actually. We're a lesbian-led organization, currently the only one in the Pacific region. So we do this work of interlinkage with interlinkage approach, which actually about we do not just come into spaces to talk about our work as LBTI, but also ensuring that we are bringing the economic, the ecological, and the social element of all the conversation. And how does that impact our bodies and how that affect also the work that we are trying to do. And for this evening tonight, I will focus it like as both the moderator and Arundati has mentioned about, how does climate change, significant ways that climate change affects the population you work with. Maybe to start off with the grounding that we're one of the front lines impacted region, and when it comes to really talking about climate impacts, and having to say that when you're also one of the region that has a very high level of gender-based violence, and you also have, a region that underneath 50% of accessing contraceptive services, already you can get a picture of how then impact of climate change have different impacts on women or gender non-binary people and girls in the work that we do. One of the ones that I really want to specifically share is that the causes that it has on women's body, on the unpaid care work and climate change impacts, the cost it has on a woman's body and the mental emotions. We have women who have lost their homes overnight and the very next morning they are expected to be doing communal work into bringing back, putting back together a house or a village, gathering village, and making sure that, men's, children, and everybody within that village is being fed, right? No time for women to even recover mentally or emotionally that they have lost their homes. And we also have these issues on, the increase of sexual and gender-based violence and gender-based discrimination during disasters. How evacuation centers are set up that are not really friendly. It's not only safe and friendly, not only for women, but specifically for gender non-binary people, women with diverse sexual orientation, right? Trans women. So these are some of the significant impact, and also the economic impact. Many grassroots communities rely on natural resources for their livelihoods. I will share in the chat later with Bhuvana and them the resources of the UUU, one of the Diva research that we've launched in 2019, which actually have 82% of lesbian, bisexual, trans now Fiji do not have access to formal work areas. So they do rely on natural resources for their livelihoods. Climate change can jeopardize industries such as agriculture, fishing, and tourism, and job losses and economic stability. And if you are from a minority groups, that you rely on precarious, they do a lot of precarious work, like car wash attendee, service station attendee. So part of them trying to, being sustainable is relying on natural resources. And when climate change hits, it really taken the struggles of this specific community in trying to sustain their livelihoods into another level. Also about displacement and migration, as certain areas become uninhabitable due to rising sea levels or extreme weather events, communities may force to relocate. This can result in loss of homes, livelihoods, cultural ties, giving rise of climate refugees. And also when you are from a minority group, right? We're not even accepted from where you are living and you having to be forced to move, that accelerate your challenges in how to even be accepted in the new places that you have to relocate to. So that's where the element, of gender-based discrimination and gender violence really also kind of pick up. And I think the last one that I would really want to mention, which links to the theme, which is about menstrual health also, is the increased health problems and worsen existing ones that is around due to all these things. And when you are if it's even hard right now to talk about menstrual health, then it really is then hard for you to be able to access these services when you're from a minority group. One of the ways that we've been trying to do that is we do not talk about menstrual health. We do not talk about without talking about sexual and reproductive health and rights, making sure that that is the element, that is the core element of having this discussion. Because if we are able to build sexual reproductive health and rights, is actually, like the element of bodily autonomy, the rights to make decisions of your body, also the right to have to access services that is about these other issues that we are facing as women. And also for menstrual health, we feel like that kind of really like ties, we can never work on menstrual health if we don't prioritize sexual and reproductive health and rights. I think, Bhavna, I will leave it to that for now and for the next speakers to go on.
Thanks,
Thank you.
Viva. I think what we'll do is we'll follow up on what you shared as part of our following discussion. Lady, I am curious to know more about your experience in East and Southeast Asia, especially with your work on climate resilience with the youth in the region. Yeah.
Thank you, Bhuvana. So adding to what my colleague from Viva said, I want to focus more on girls. So when climate, especially the short-term effects of climate change with disasters and flooding and typhoons, especially here in the Philippines, like we have one right now, and everyone, sorry. So girls are affected in terms of like education. What we see is that girls' education stops, and it's really hard to go back to school. They do face like interruptions to services, but also information. And with that being said, like education is like part of their coping, and also like being resilient. But when what happens, no one focuses on that. So information on menstrual health, hygiene, where to get help, especially if they feel stressed or they have like mental health issues surrounding the emergency, then it significantly like puts more girls at risk. And what we've seen in terms of like some like in terms of displacement and like more long-term effects is that young people are easily introduced into sex work, as they are not economically stable. And if they don't have parents who are economically stable as well, there are many adolescent-headed households, and many girls and even boys resort to transactional sex in order to survive. So there have been like issues of STI, HIV, and the likes. But yes, so there. I think I would like to give it back to you now, the floor. Bhuvana, over.
Thanks, lady. Thank you so much. Ali, on the same line, I'm curious to hear about what have you folks identified as some key impacts of climate change on the stakeholders that you work with at Y-Labs?
Thank you so much. Yeah, I think we've already touched on so many great different aspects, but I think really at the core of climate change for me is that it shows that it amplifies existing global inequities, right? So we see that women and girls, particularly those in low resource settings, are disproportionately affected, bearing the brunt of its consequences. For example, by 2050, between 300 million and 1.2 billion people are projected to migrate within and across borders due to climate change. And 80% of those displaced are expected to be women and girls. This not only exacerbates the challenges that they already face that we know of, but also undermines their ability to adapt and recover from climate impacts, particularly when it comes to their sexual reproductive health and rights. At Y-Labs, we recently completed a rapid scoping review of peer-reviewed literature to really explore those direct and indirect effects of climate change on various SRHR outcomes. And we know that, from extreme weather events such as floods, droughts, and heat waves, it has a direct effect on women and girls' physical and psychological stress. For example, we found a global meta-analysis of 27 countries found that during a heat wave, the rate of premature birth increased by 16%. That 16 is a lot. And we also see that climate change disrupts livelihoods, like we've heard a lot already today. It reduces the incomes and creates food insecurities. And these economic pressures really increase the risk of different poor SRHR outcomes, including limited access to health services in order to pay, higher rates of gender-based violence, unplanned pregnancies, and sexually transmitted infections. We found a research article from Kenya that found 60% increase in reporting intimate partner violence in counties that experience a severe flooding event. And when we consider the impacts of climate change, specifically on menstrual health, a review of literature really highlighted that extreme weather events and different climate events disrupt access to menstrual health products, which, like we all said, I think is really well known and well documented. But I think the effects of climate change on menstrual health extend far beyond access to products alone. We have to think of the whole ecosystem that menstrual health happens in. And we see that climate change impacts people who menstruate by limiting their access to private, safe spaces where they can change and manage their menstrual health. These crises often disrupt their waste disposal systems and restrict access to clean water and sanitation facilities, making proper menstrual health management even more challenging for them, creating, mental health challenges as well. And during disasters, relief efforts, menstrual health initiatives are often deprioritized as there's such a focus and shift towards immediate needs for women and girls. We also find really similar impacts of climate change on menstrual health to SRHR. So for instance, Lady also just mentioned on it, our research has shown that in some countries, young girls have been forced to trade sex for menstrual health products, really putting them at higher risk of, again, STIs, increasing their vulnerability to sexual and gender-based violence. I think overall, really what it comes down to is that climate change is threatening to reverse so much of the progress that many of us working in sexual reproductive health have achieved. The gains that we have made in reducing child marriage, maternal mortality, access to contraceptive choices, and menstrual health are increasingly at risk. And left unaddressed, these risks pose a serious threat to the well-being and autonomy of girls worldwide. And this is particularly true for menstrual health, given the multiplier of risk when it comes to menstrual health products, water sanitation, privacy, and dignity are ignored. And I'll pass it back over.
Thanks, Ali. Thank you so much. Stella, I'm curious to know a bit more about what has your experience been in the work that you've done in environmental justice with communities across India. What are some of the impacts that you've seen, tangible, intangible, long-term, or immediate impacts on the communities that you work with?
Yeah, so I'm gonna speak a little bit more broadly because I don't specifically work in menstrual health or in gender justice for that matter. I work primarily with fishing communities in coastal areas, so I'm going to focus on the kind of impacts that fishing communities face. So one aspect of this is, of course, what a lot of people have mentioned, Arundati spoke about as well, in terms of the when there are extreme weather events, especially when the extreme weather events become disasters. And so there is, you know, when it is episodic and it's urgent, there are conversations around issues of clean water and menstrual care products and safety and a lot of things as well. And this then with climate change, because we know that the intensity and the frequency and the sort of range in which you know, extreme weather events are happening, um, have sort of, you know, and there's a lot of unpredictability that's sort of coming with these crises, right? So for example, in India, where the state that I'm from in Kerala, we expect to see flooding happening in the months of like August, but now there are like unseasonal floods. There's unseasonal wind patterns happening in, say, September, October, things that people are not completely, you know, prepared for, especially in areas where, you know, for a lot of fishing communities, small scale fishing communities, which go by looking at, you know, so there is all of that, but then there is also what happens on like, you know, the slow onset events that tend to get taken less seriously, even within the climate change sort of like when we're talking about climate change. So this, for example, can be erosion, right? So erosion is something that again affects the west coast of India and some parts of the southern east coast as well, very strongly. But erosion is not an episodic event. It's something that's happening slowly over the course of a lot of time. But then it's also leading to displacement. It's also leading to gendered impact, specifically in the sense of looking at, for instance, beaches in India are used as commons by fisher women who mostly do a lot of the drying aspects of the fishing. So now that beaches are no longer accessible and are no longer available because they've just been like sort of eroded out, women now no longer have spaces for, you know, for their drying. So there's a lot of livelihood impacts. Looking at, say, for instance, what Viva said about the precarity of work that gender and sexual minorities have when there is livelihood loss and climate change leads to livelihood loss. When that happens, it tends to be the women who lose their livelihoods and their sources of income first. And adding to that, there is also one of the other things that I've heard women talk about is they get moved, like because of displacement, you find villages and hamlets sort of broken apart because you're just trying to find land wherever land exists for them to move. And so you're also breaking a lot of like kinship ties, which particularly become important for women who rely on these kinship ties a lot. So I have a lot to say, but I'm keeping mind of time and I'll talk more about things later.
Thanks a lot, Stella. Thanks everyone. And I was just making quick notes of everything that you all were saying. And I realized that in the past 10 minutes, we spoke about climate change and its intersection with issues like GBV, IPV, with the impact on LBT communities and other minority communities, impact on fish workers, and impact on adolescents, both adolescent boys and adolescent girls, with respect to not just menstrual health and hygiene, but also mental health issues, STIs, health issues, looking at sex as transaction, access to products, access to contraceptives, right? Like, I think there are a bunch of things that we spoke about, and in the power pack 10 minutes that it was. And I do understand that we don't really have enough time today to unpack each one of these, but I would like to see how we can unpack at least some of this as part of the effort that you folks have put in the work that you've done so far. So I don't want to take up too much space here. I'm gonna quickly sort of move on to getting a bit more curious about the different kinds of work that you folks have done in your spaces. I'll probably go back in the same cycle and start with Viva. Viva, very curious to hear a bit more about the work that you folks do. You did mention that, especially with the work that you do with the LBT communities and women, given that Fiji already has much like really low rates of contraception adoption, but also like very high rates of GBV. I'm curious to hear a bit more about how when there is a climate disaster, like I think a couple of things that I probably I'm curious to hear a bit more about this from you. If in terms of your work in the climate change space, is this when there are acute events where you're like responding to a disaster, or is it more mitigative to say, or is it more preparatory to say, okay, like this region, I mean, this region is prone to climate sensitivities, so how can we sort of be more prepared for this? So I'm more curious to understand this piece, Viva, from you in terms of where does your work fit in, and what does that mean for the communities you work with?
Thank you, Bhavna. So yes, definitely. So part of Diva's mission and how we always love to do the work that we do is making sure that we are always balancing the work that we do at the structural level and also the material level. So structural level, I would say, like, what are the work that we're doing that we are really trying to influence policy, making sure that we're part of decision-making spaces that is beyond our own little Diva coalition spaces. So part of that is the work that we are doing also with the Pacific Menstrual Health Coalition, as I've mentioned, and also other coalition that we are part of, which is like a feminist climate Pacific Feminist Actions for Climate Justice, FIFA for CJ, we always say it. So those are the areas that we actually try and come together to make sure that, whatever the work that we are doing, it's not just about responding to the communities, but also trying to influence policies that are out there that is about women's and gender climate justice and how we are portraying that out into the world. So in terms of the material work that we do internally, we have a network within the Diva organization that has been, that evolves from 2014 and is still with us today, which is the Women Defend the Commons network. And within that network, we're able to access women's groups in villages. We're now working with more than, I would say, 80 villages in Fiji, women's group. And having to say that also comes the load with the expectations in how you do your deliverance of responding to disaster or in making sure that they are getting the assistance that they need. So part of the work that we do is through these networks and other networks, like the Ganga Grassroots Young Feminist Network that I'm actually coordinating, is, how do we marry these two networks' work and interest in terms of ensuring that they are accessing, having access to safe and clean water. They're also having to access SRHR productive. Like example, we now have, because we've been asked if we can provide morning after pills just to assist young women in grassroots and village setting, which they literally have like no idea in the beginning that those kind of services and those kind of things is available for them. And one of the things also that we're doing very well in is, how are we responding back to women that, they having to need water, not only just for menstrual health, but also for daily livelihoods, because as we all human, we need water every day. And I have a picture that maybe I show. It's like we still have women in situation where women still are, wait, let me just get rid of it. That still having to depend on these green pools for accessing water, for their own relief. And you have women that are still, working out, digging out old wells to get water, right? And these communities, how we're trying to do work with them is not actually to come in and play saying that we can save them, but how we do it productively and in a way that it's very participative and makes sense to what they need is we do consultation with them. We build networks with them. We make sure that it's not a one-off assistant, but how do we make sure that they also get chances to be in spaces where they can talk about these issues themselves? I mean, today might be me, 2 years back down the road or next year when we have this firehouse again, you might have someone that is not from the Diva MC or staff, but someone from the community to actually speak on these issues because it's been their lived realities. So those are some of the work that we are trying to do, like really balancing that. And also, I think the one that I can also share here is this work that we are trying to really do with, how do we scrub off patriarchy system in place first within community setting, with the villages, so women can have the possibility to even be part of conversation when development partners, when groups, INGO come into the spaces. A lot of these spaces has been created, but they are never always woman friendly or welcoming. Women are always expected to take care of people that comes in with all this information and knowledge. So how we have actually twisted that is making sure that we don't just work with the woman, we have to invest in working with local leaders within those areas. How do we build relationship with them first? Because then that gives us a leeway, an entry point that we can really get in and work with women. And women could also have the ability to raise their issues without having to worry about being oppressed or intimidated into those kind of spaces. So, for us, it's an ongoing work that we're still trying to do and get better at it. But at the same time, we're also congratulating ourselves because it's we might look like we're a team of like we have multiple teams on board. So we only have literally eight staff right now. So there's 8 staff and we are all working on these 5 areas of work, which is about human rights, economic justice. How do we then build a movement or, disrupt social movement to make sure that we are having to have open mind to build other movements? 4 is actually about, how do we respond to urgent actions? How do we respond to minority groups? How are we showing up when we are talking about urgent responses and service delivery, like how are we really serving that? And then with number 5 is just about sustaining ourselves. As we all know, we hardly get a chance to even be acknowledged that we need those well-being, we need the resting time. And then if we are, since we are all women, we are going through issues like menstrual health and menstruation, and you're having to deal with climate impacts, that has a cost on women's body. And we don't really talk more on that. We love to talk about things that is about, external to general, but we don't really have time to really dig into it. Like, we are doing this work together because we care, because we understand the same struggles that other women go through. Having young women to go down by the river to relieve themselves just because when they're menstruating, because there hasn't been any water provided into their villages or their community for a past week or going on to 2 weeks, that's a different kind of struggles or issues that we have to really talk about. Because at some areas we might say like, oh, that's it's a norm thing, like we also face that, like the no water, so we just rely on others. Some, when you are already impacted by economic injustice, it's very hard for you then to tap into those services in just getting water or arrange water to be delivered to your homes. While for some communities out there, they literally have to rely on those green pools. They literally have to dig up old wells to look for water resource again. So I think like those are some of the work that we are currently doing and we are still doing. And of course, the continuation of negotiating in spaces where they're really talking about climate change and how it impacts it on a woman and gender climate justice. Thank you.
Thanks, Viva. That was very powerful and gives us a lot of food for thought. I would like to hear from Lady in terms of the work that they've done in East and Southeast Asia and the Oceania region. And I'm curious to know what are some of the approaches that you folks have tried and tested and what has worked for you. And yeah, what does it contribute to in the sense that in the sense of objectives that you set for the work that you do. 1 second, I'm just going to quickly unmute you.
You should be able to unmute yourself, lady,
Yeah.
now.
Thank you.
So, the work that IPPF does is largely service delivery, so primarily providing the full range of sexual and reproductive health services, and that includes menstrual health. We provide services in normal settings and also in emergency settings. So our thrust for the past few years is actually to increase our resiliences for the services that we provide, to have that ability to provide the same quality of service in a normal setting, but also in an emergency setting. What is an example would be like to make the clinics more resilient, but actually a lot of work has gone into making our communities resilient, that they are involved in preparation and then mitigation. So last year, we've worked a lot in terms of advocating for preparedness measures. We have started engaging young people even in disaster preparedness and how they can respond, how they can be able to be more resilient. So that's largely our volunteers during emergencies in terms of like from handing out supplies and also including menstrual products. And our hygiene kits are actually young people. So we wanted them to have a greater power in terms of like picking up in terms of what their issues are, but also how they can lead their communities to become more resilient, be more prepared. Also, that being said, like working with communities, we also work with like vulnerable and socially excluded groups. That one example is LGBT groups who are actually menstruating. So, for example, in Thailand, we're working with LGBT group, and they wanted to talk about destigmatizing periods among like people who have diverse sexualities. So that's quite interesting in terms of raising community awareness, providing that platform for them to also have that space to talk about their rights, not just like female and male, but like also looking at bodies, like, and we have found that to be very helpful, like having these conversations with communities, working with young people, building leadership in terms of resilience for sexual and reproductive health services and in the issue of climate change. Also, just recently, we launched our youth network in the Pacific. It's called Youth Oceans. So it aims to bring young people across different fields. So we've understood that a lot of like SRHR has only been working with SRHR. We've tried to come across like different issues like HIV and abortion, but in terms of SRHR and climate, like we haven't had that made that connection. So we've started with the youth network to consciously bring in young people across movements to have a stronger youth voice and like find that intersection with SRHR and menstrual health and climate change. So So we go into from service delivery to advocacy, and we do it mainly working with our communities and our volunteers. I guess that's it. I will share link to our position paper on SRHR and climate change in the chat, and over to you, Bhuvana.
Thank you. Thanks, lady. Ali, I'm going to hand this right over to you, given that we're running slightly behind time, without necessarily adding my comments to this. Yes.
No worries. I can jump right in. Can everyone see my screen okay?
Yeah.
Wonderful. Yeah, so I think a specific intervention that I really want to highlight here that we've co-designed with young people who menstruate is our Cocoon Project. So this project took place in the Bidi Bidi refugee settlement located in the West Nile region of Uganda. And while the primary cause of displacement for many South Sudanese refugees has been civil war and political instability, I believe climate change and environmental degradation are increasingly recognized as a contributing factor to existing vulnerabilities. So I think we could use the Cocoon Project as a great case study here to think about how do we design an intervention in a humanitarian context, specifically thinking as well of the environment and what exists in it and the context that it is in. So we used a human-centered design approach to co-create services and safe spaces for menstrual health management within the community, particularly with women and girls, but as well as included men and boys in our conversations too. This project consisted of 5 phases. So there's background research. We did design research of interviewing young people, both again, women and men, on menstruation and the challenges and so forth. And then we got into the fun part of what I love, which is the rough prototyping. So you can see an example here. We started to cut out cardboard and think of different spaces and services that could help within these challenges. We then brought to live prototyping and finally finished with a 3-month pilot. So specifically within the Cocoon Project, this participatory method really ensured that solutions were culturally appropriate. They allowed us to iterate on solutions based on real-time feedback, ensuring their desirability and feasibility within the real world. And one of the key outcomes of this HDD process was the development of the Cocoon Mini, which is on my screen now. So it's a private structure for managing menstruation. Women and girls were able to design these spaces specifically for them and choose critical elements like private latrines, a bathing area, a disposal system that's often not thought about, water access, and really addressing the gap of different menstrual health management facilities in these humanitarian settings. Overall, we built 20 Cocoon Minis in that specific area. And during our pilot, we had just over 300 women and girls use the Cocoon Minis. We found that within the pilot phase that they really demonstrated acceptability and desirability, where 95% of our users reported it made managing their menstruation much easier. So features such as the private latrine, solar lighting, disposal systems significantly improved the way that they managed their menstruation and provided a greater sense of safety. So some actual photos you can see here is our disposal systems, how it was set up with a bathing unit, a changing unit, a washing unit, and so forth, and there's solar lights within the Mini itself, to kind of just give a look of what this was really looking like. But some of our key learnings that we saw was local ownership. So involving community members, not just women and girls, but also including men, especially in the sourcing and the construction of these Cocoon Minis, really fostered an ownership of the Cocoon Mini and long-term sustainability of them. So this engagement also reduced the stigma around menstruation and allowed for more open conversation as well between men and women, which I thought was incredible. The fact that the space existed within this community and it was designated as a place for menstruation allowed men to ask, what is this? And women to respond and have that conversation starter, which was fantastic. Another huge aspect was the safety and privacy. So the addition of locks and privacy walls and secure waste disposal systems significantly improved our users' confidence and reduced anxiety around managing their menstruation in public and unsafe spaces. One gap that I do want to highlight within the community, within the Cocoon Mini, that we can think about is how do we complement it with different software solutions? And when I say software, I'm thinking of education and behavioral change programs, sensitization programs. So while the physical infrastructure or the hardware is really important, thinking about how do we continue to educate both men and women on menstrual health and breaking some of the culture taboos when it comes to disposal and so forth, really is essential for long-term impact. But I think what I really want to highlight here within climate change and thinking about the interventions that we can create, I think we really found that overall the iterative, creative, and user-centered nature the HCD process allowed the team to work in partnership with both with people who menstruate and key community stakeholders to prototype and develop solutions really helps to integrate people who menstruate's main priorities. It really allowed the space to be owned by the community members, meet all their needs and challenges. The Cocoon Mini really served as a proof of concept of the utility of applying HCD methodology in this co-design process. And just also demonstrated that a space could largely also be run and maintained on a local level without the need of continued heavy stakeholder engagement, which I think is also really important when thinking of these crises. So I will pass it back over to you, but I can definitely share some more resources and results from the Cocoon Mini project.
Thanks, Ali. This was extremely insightful, and we loved seeing the prototype to the final product stage. Thank you so much. I'll quickly, I would like to speak with Stella. Stella, we have a slightly different question for you in terms of the work that you've been doing and how that sort of comes together with what we're talking about today. What I would like to understand is how do you place menstrual health and hygiene in the larger climate justice narrative? In terms of what you've been hearing, given that you're on the other side of this discussion, and we are all conveniently on this side of the discussion. So we are very curious to know more about what is it that you hear in the mainstream climate justice, climate action narrative with respect to gender and menstrual health, and where do you see some of the gaps there? Like, are there dominant narratives? Are there narratives that don't come up at all? Are there narratives from whatever you've heard today in this conversation that need more spotlighting? Yeah, curious to know more.
Thanks, Bhuvana. Something I was thinking about since we talked about having this panel. And I think to be perfectly honest, from the climate change perspective and like working even in climate justice where we work with communities a lot, we actually don't hear about menstrual health at all, right? Like the only context where we hear about this, so there's a couple of like very sort of small spaces where we hear about it. One is, like I mentioned, in extreme weather events, when there's a disaster, you will hear some conversation around access to water and products. And then the other sort of space where you hear the narrative go is in terms of talking about sustainability of products. So for instance, when I was looking up, when I was just sort of, very basically sort of Googling, the climate change menstruation, because again, like we don't really hear about it. The dominant thing that I was sort of finding, and this is actually very common within the climate change narrative and rhetoric as well, which is a focus on individual responsibility and individual sort of action. So a lot of like some of the writing that I was reading was around the kind of carbon footprint that the use of menstrual products has. Right now, this has a whole bunch of problems. Because this is something that when we come from a climate justice perspective, where there is a very strong clarity to say that climate change is not about individual responsibility, right? So we need to move away from this idea of having a carbon footprint. And there's two reasons for it. One is a very easy one of just talking about effectiveness, right? Because, so I looked up the statistic and I found this somewhere where it says an individual generates around 8.9 kilograms of carbon emissions in a year on average. If you compare this to the global carbon emissions, the global carbon emission for 2022 was 36.8 billion tons as opposed to 8.9 kilograms, right? So this is 0.0000, like just add 7 zeros and then put like a point, like a 7 at the end of it. That's the contribution that we're even talking about, right? So in a context where we're talking about a lot of climate change, there is a lot of clarity now we have in the last few years at least, that a majority of the responsibility of climate change lies on governments and on companies. So, there is a lot of information about how the carbon majors, there are 100 big companies that are causing about 80% of the climate change on the planet, right? If you look at statistics like the carbon budget, you can see how the US and the EU and then a little bit of China are sort of responsible for a large majority of the historic carbon emissions, which are then leading to this. So one aspect of this, what I have not seen, and it might just be because I don't know enough about it, is when you're looking at, when you're talking about mitigation, the focus cannot be on what are individuals sort of generating. If there needs to be any focus on, mitigation from a menstrual health perspective, I would think that focus would lie on looking at companies and how are companies producing, menstrual care products, for example, right? So a lot of the focus needs to be, again, on government and on companies. Which is, so this happens like we work through, through shareholder activism. There is currently a lot of climate litigation going on to get governments to sort of speed up action on what they're going to do with climate change, right? And the other aspect of it then is to look at, I think the focus here in this panel at least has been, a lot of it has been on the adaptation aspect of things and building community resilience. And again, one of the things that we don't see enough of is so there is very little conversation. There's very little of community voices even in the climate change conversation, right? A lot of the climate change conversation is very scientific, very technical. We don't hear enough about from people on the ground about how climate change is affecting them. And I definitely don't hear enough about menstruation in that context at all. So one example is water, right? Like access to clean water, which I heard mentioned several times within this panel. And access to water is a huge part of the conversation around climate change, especially in the adaptation context, because one of the things that's recognized, especially in South and Southeast Asia, is that, before sea level rise and erosion and these things kill all of us, what's going to kill all of us is, kill all the vulnerable communities, is not having access to clean water, right? So within the fishing communities, this means that there has been a lot of saline water intrusion that's gone, so the sea water, the salt water is basically moving further inroads, contaminating a lot of freshwater sources, right? But when I hear about the water discourse, what I hear from my perspective is we hear about how people don't have access to drinking water, and we hear about how people don't have access to, at best washing clothes or utensils, right? But that's where the focus is. Honestly, I have not yet heard any strong narrative saying women don't have access to water for menstrual care, right? Which is, you would think would come up, considering because there is a focus on the gendered aspect of things, but even then I don't hear enough about it in terms of community voices from the side. So that's kind of where I feel like there is a clear sort of, there's a bit of a gap, you can clearly see that there are overlays, but it's almost like parallel talking points that are sort of happening in a lot of spaces. Yeah. Back to you, Bhuvi.
Thank you so much, Stella. Thanks, Stella, Ali, Viva, and Lady for sharing such interesting insights from different intersections of the work that you're doing, whether it's with youth, with adolescent girls and boys, with fish workers, with the LBT communities, on SRHR, on climate justice. I think this is a very interesting, intricate web of work that we're talking about. I know that I did have one final question for you folks, but given where we are with time, I'm going to sort of move right on, because we're very curious to take some of the questions from the audience and like really hear everyone's thoughts on where we stand on some of these as well. So over to you, Arundati, and then we can wrap up post that.
Super. Thanks so much, Bhuvana. And I agree with you. I think what's been really interesting for us to hear is the real expansion of the lens and the narrative when we're looking at menstrual health in the context of climate change. And for us, again, we want to emphasize that many of us in this room and as speakers, we're very embedded in the menstrual health and hygiene space. But we know that this is not the only issue when we're looking at climate change, but it is an important issue, and that lens has been fairly narrow. So I'm very happy to see how this webinar and through our fantastic speakers, we've been able to widen that. We've got some very interesting questions. So I'm going to call out some of them, but if you can address them in the chat box as well, there's a specific one. So one is from Priscilla, who's asking about what are the policies and programs in place. So we've heard a little bit about the programs, but also what are the policies that are in place, and what are those policy gaps and opportunities that we may need to address. So I think it's a fantastic one. Stella, you did allude to a potential policy angle when we're looking at manufacturers of products and their role when in making and producing better quality products. We've had a fantastic question from Mayuri, who's asking that a lot of this work that's looking at SRHR, gender justice, menstrual health in the context of climate change is led by women, by feminists, but men have a role to play. So what is that role that we say that men have to play? And within that, what is the role of men from the global south and the global majority? We have a question from Amina from UNFPA, and she has a specific question for you, Ali, on the Cocoon project. So you can look at the chat box to answer that. And lastly, from Tanya, we have a very interesting question on supply chain and the upstream supply chain issues with regards to menstrual products, and how is that playing out? So very in-depth questions. And we don't have time to answer all of them, but hopefully this will lead us to more. But I'm going to ask you, all our speakers, to respond to two specific ones, and very briefly. One is, do you have a policy example of where a policy that has responded to menstrual health in the context of climate change? And for those of you in the audience, if you got examples from your countries, please put it into the chat box. And secondly, what's the role of men in this? So anyone can go from our fantastic speakers.
I can take a go at it first. I think the policy question I think is really interesting. At YLabs, we just completed a review of all national adaptation plans and health national adaptation plans to see how they've incorporated, or in many cases not incorporated, different aspects of SRHR. Really sad to report that menstrual health, I believe, was not mentioned specifically in any of them. But I think something to really highlight, and especially to the overall broader aspect of SRHR, is this idea of a voluntary rights-based approach. I think a lot of times, and Stella, you hit on this as well, is that a lot of times the blame or like the reason to, like, for example, contraceptive services, that can fix the population growth and resource constraints, right? And so, but that's putting like a blame on the women themselves. So thinking about how can we incorporate policies that really come from, a narrative of resilience, of agency, and climate gender justice, I think is really what's important, and like kind of shifting that narrative away that women are passive victims or environmental perpetrators, sorry, is really key in a lot of these policies. That was the first one, so I'll let other panelists go and come back to answer the other questions as well.
It's a very powerful statement, Ali. You know, environmental victims or perpetrators of environmental injustice. Thanks for that. Anyone else from our speakers who wants to take a stab at either the policy question or how do we engage men and boys in this? Viva, go ahead.
Yes.
I'll just share from the Pacific. It's still a challenge for us, for feminist group, into even negotiating on CSE, into becoming policy, into having, you know, it implemented in education system, contraceptive sexual education. Left alone, when you're from a region that is still treating menstrual talk as a taboo, then it's definitely, regardless that you know, we are creating spaces where we can talk about linkage of menstrual health and climate impact. It's still not enough space to influence that level of decision making. But does that mean that we stop the work? No, but it just means like we need to keep fighting to make sure the building of the coalition, being part of a conversation where they're even talking about public health services and how we demonstrate that keeps going, but at the same time trying to work for the main goal, which is ensuring that we have policies and legislation that is to accommodate menstrual health and how climate change have an impact on them. So I would leave to that for this response for now, and then I will definitely want to share something on about the chain of supplies. Thank you.
Yeah, thanks, Viva. And lady, sorry, I cut you off. Go ahead, please.
So, in terms of policy, one good policy that we could look at is in the Philippines, wherein part of the reproductive health law is ensuring sexual and reproductive health services in emergencies, which means like the full, like not the minimum, but also like that includes adolescent health in emergencies, which then has like every adolescent would have that issue of like menstruation, right? So, in the responses of the Philippines as well, it has been like very important. Like as important as goods is to provide hygiene products. Like the issue of having underwear after a disaster is greatly recognized by a lot of people. Like we've also had communities saying, you know what, it's good that even if it's just female underwear, my husband gets to use it. It's calm and it's like cool. But that in itself, like even menstrual products for teenagers are there in terms of the kits. And importantly, what Viva said is on education. So especially for when the displacement has been protected, it's like to introduce like concepts on like hygiene when you are there in like the evacuation setting. So having these like resiliency measures, educating young people, involving them in terms of spreading education on like what your body is going through, what stress you're going through, and importantly, linking them to services. So that's a good policy that is in effect, though it could still use more of like pushing at the local level for all of that to be implemented in the Philippines. So that's just one. We are working to have the same policies in our region as part of the disaster risk reduction strategy. We hope in the next ministerial conference for the APMC DRR, it's happening in the Philippines, to have to influence more governments to adopt such responses. Equally understanding that menstrual health is also like a very important issue. Commenting on that, like so linking to the next segue to the next on how to involve boys. I think and men, it's having them as our partners in terms of advocating for the needs of women in these conditions, but also recognizing that like they do have a role to play in like reducing the burden of care, which is also like affecting like our menstrual health, right? So like teaching young boys about female bodies that menstruate, talking about consent, also protecting oneself and our community, is very important. So I guess that's where my you thought. And on the issue of water, I really thank Stella for bringing that up because a lot of measures for like improving water is actually has a burden on the women. It's always like what can be done to improve the water in the home. And it's always the woman who has that responsibility or the girl who has the responsibility of collecting water, but boys have a say too. And these like our water, like access to water should look into like more social, like what government should do to make them accessible, not just like at the household level. So thanks. Thanks, Arundati. Over to you.
Thanks, lady. Great comments. And I do want to say, as people are dropping off the call, is that we're actually planning some deep dive workshops that Bhuvana will share a little more about, and we'll be getting into issues of water sanitation, hygiene, access to health services, products, and we'll be planning these in the next 4 to 6 months. So stay tuned to hear more about that. Stella, do you have any thoughts on the questions raised on policy and on engaging men and boys?
Sure. So on the policy question in India, there actually isn't any real policy even on climate change itself. We're entirely reliant on climate action plans, which are technically policy adjacent, but are not really law and policy. And of course, there is like, I've been looking at state climate action plans of like 6 different states, and I have barely seen anything even on gender, forget, something specific on menstruation. But having said that, actually, this is a good time for that conversation to come in because within the climate change movement, there is a lot of conversation about bringing in policy and law around climate change, improving state climate action plans. A lot of states are working on their state climate action plans right now. So I think there's definitely like space for that. I don't have much to say about men in the space because again, I don't work in the space except to say that a lot of the policy makers, both at the national levels and at the state levels and at your local levels, like your panchayat officials, are all men. So when we're talking about bringing menstruation aspects in, there's definitely a role for men because they're really the decision makers around climate change almost entirely. So that's where I see the role of men coming in.
Thanks so much, Stella. And again, thanks to you, to Viva, Lady, and to Ali for taking the time to respond to these questions. I know we haven't gotten to all of them, but we hope that this is the start of a much longer conversation and dialogue that we will continue to have. Bhuvana, over to you to close this.
Yeah. Ritika, can we just put up the slide, please? Thank you. We just want to quickly share that this is a 4-part working series over the next 6 months. And today is the first of the 4 parts. We would love to have you all join us for workshop 1 and workshop 2, which will be roughly around October 3rd week and the December 1st week before people go off on a holiday. And we will let you know when the close of Fireside chats will happen, which will also be a dissemination of our findings and advocacy and putting the word out there and really figuring out what action plans could look like starting from the conversation that has been initiated here. So yeah, we really look forward to like having more of you participate more consistently. I would also like to quickly add that the idea is for us to come up with at least 1 or 2 deliverables, not be too ambitious given that a lot of us are very busy and it's so hard for us to come together consistently as well. But have 1 or 2 deliverables that we can commit to and work towards as part of these workshops and beyond, and see what and where that can lead us to in the next 6 months. Arundati and I will be sharing a form across very soon along with the takeaways in the next week or so. And we would love to have signups and see how we can take this forward and build on this super exciting discussion, actually. This has been one of those that's kept me on my toes and like has been very diverse in many ways. It's not only menstrual health, but a lot of allied areas that we've touched upon. And I'm very, very glad to have had you all as speakers here. So thank you. Thanks a lot. And yeah, we really wish we can actually create more spaces for engagement. But Arundati and I keep talking about this. And then we realize that like, no matter how long the call, we keep running sort of short of time. But it's something for us to figure, and it's work in progress, and we will continue to figure that out. Thank you so much. Thanks for being with us. Yeah, and please do look forward to hearing from us. Thanks.
Thanks, everyone. The recording and takeaways will hit your inbox in 2 weeks. Thank you. Have a good rest of the day.
Thank you.
Thank you, everyone.
Thank you.